All right, this is the second lecture of Chapter 1, and this is going to be a shorter lecture. We're just basically going to be going over body cavities, membranes, excuse me, and abdominopelvic regions. So internal organs are housed within enclosed spaces or cavities. Body cavities are named according to their surrounding structures, and body cavities are grouped into two broad categories: the posterior aspect, or the back of the body, and the ventral, or towards the stomach cavity, towards the belly. In fact, the word ventral comes from the Latin word ventere, which means belly. Okay, so more about the posterior aspect. This is completely encased in bone, so this is going to include your spinal cord and your brain. It's physically and developmentally distinct from the ventral cavities. So not only is it a separate space, but in utero it develops from different tissues than the ventral cavities. It's subdivided into the cranial cavity, which is formed by the bones of the cranium or the skull cap. It's basically the part of your skull that doesn't include the facial bones, and it houses the brain. And it's also composed of the vertebral canal, which is formed by the bones of the vertebral column and houses the spinal cord. Now, the ventral cavity is much larger than the posterior aspect. Body cavities are not completely encased in bone here. Instead, they're lined with serous membranes, and we'll talk more about that in a second. Your ventral cavity can be divided into the thoracic cavity and the abdominal pelvic cavity. The thoracic cavity contains the heart and lungs, and the abdominal pelvic cavity contains the digestive system, organs, your kidneys, and most of the ureters. So this is showing the posterior aspect here and the anterior aspect here. And remember, the posterior aspect consists of the brain inside of the cranium and the spinal cord inside of the vertebral column. Here's the ventral aspect, and it is composed of three main body cavities: the thoracic cavity, the abdominal cavity, and the pelvic cavity. And this is frequently referred to together as the abdominopelvic cavity. Here it is from a frontal view: the thoracic cavity, and below the diaphragm, the abdominal pelvic cavity, or abdominal cavity and pelvic cavity. Here they are labeled for you. I would like for you to be very familiar with these cavities and which organs are in them. So the subdivisions of the ventral cavity, which is what we just talked about, are lined with serous membranes. There's two layers to the serous membranes. There's the parietal layer, which is the outermost layer. It's the layer that covers the body cavity. And then there's the visceral layer, which is the innermost layer, which covers the surface of the organs. There's a potential space between those cavities called the serous cavity. And what potential space means is that there's nothing in between there except a little bit of serous fluid. But it can collect fluid, or in a very bad situation, it can collect air. And so it's a potential space. There's potential for it to grow. Serous fluid is secreted by the cells in the serous membrane, and it acts as a lubricant. So what these membranes do is not only do they help attach organs to the walls of these body cavities, but that potential space in there that has serous fluid helps reduce friction caused by movement of the organs against the body wall or against other organs. All right, so going a little bit further into body cavities, we talked about the thoracic cavity. The thoracic cavity can further be divided into the pericardial cavity and the pleural cavity. The pericardial cavity contains the heart, and the pleural cavity contains the lungs. You'll also hear the term mediastinum. This is the space in the middle of the thoracic cavity that contains the heart, the thymus, the esophagus, the trachea, and the major blood vessels that connect to the heart. Hold on, I think here you can see this whole area is the mediastinum here in the middle. And see how it contains the pericardial cavity? But it is distinct from the pericardial cavity, and that it contains things other than just the heart. Here are the pleural cavities here, where the lungs are. So the pericardium is a two-layered serous membrane surrounding the heart. The parietal pericardium is the outermost layer surrounding the heart, and the visceral pericardium, again, is that inner layer that directly touches the surface of the heart. Again, there's a potential space between those two layers where fluid can collect. A little bit more about these serous membranes is that think of it like one giant membrane that sort of folds back on itself and creates this space in between its layers. So that is to say, the parietal serous membrane is continuous with the visceral serous membrane. The pleura, this is the two-layered serous membrane associated with the lungs. There's the parietal pleura, and parietal would suggest what? That it lines the surface of the thoracic wall. There's the visceral pleura, which again, visceral would suggest what? That it comes directly in contact with the organ. And again, you'll see there is a pleural cavity here, this area colored in blue, which is a potential space where fluid or air can collect. The abdominal pelvic cavity, like we talked about, is subdivided into two smaller cavities. The abdominal cavity, which is the superior cavity, and it contains most of the digestive system organs, kidneys, and most of the ureters. There's also the pelvic cavity, which is the inferior area between the hip bones. This contains the distal part of the large intestine, or the farther away part of the large intestine, the remainder of those ureters, and the urinary bladder and internal reproductive organs. Okay, just like we talked about the pericardium and the pleura, now we're going to talk about the peritoneum. This is the two-layered serous membrane that lines the abdominal pelvic cavity. There's the parietal peritoneum, which is the outer layer that lines the internal walls of the abdominal pelvic cavity. And there's the visceral peritoneum, the inner layer, which covers the external surface of those organs within the abdominal pelvic cavity. The peritoneal cavity is the term for the space between the parietal and visceral layers of the peritoneum containing serous fluid. And again, there is a potential space there that can collect fluid or collect air. What I want to show you on this diagram is this. Imagine that you have blown up a balloon, and you take your fist and you push your fist inside the balloon. This outer part of the balloon would be like the parietal layer, whereas this inner part that is in contact with your fist is the visceral layer. This space here would be the potential space, and that has a different name depending on which organ you're talking about. So, for the lungs, it would be the pleural space. All right, next we're going to talk about the abdominal pelvic regions. This is very important for those of you who will go on to do clinical work. We use these abdominal pelvic regions frequently in medicine. The most common way that clinicians describe the regions of the abdomen, or the abdominal pelvic regions, is through the 4-quadrant method here, So you basically just draw a cross right in the middle of the abdomen, and this would be your left upper quadrant. This would be your left lower quadrant. Remember, because we name things in relation to the patient's body. So this is his left side, so this is his left upper quadrant. This is his left side here, this is the left lower quadrant. You go to his right side now, you're looking at the right lower quadrant and the right upper quadrant. I want you to be familiar with which organs are in each quadrant. You can go a step further and divide into 9 different regions for the abdominal pelvic area. If you start here kind of at the area that's over the umbilicus or the belly button, this is called the umbilical region. Then I go up and I see epigastric region. Epi means upon or on top of. So on top of the gastric region. So upon the stomach or on top of the stomach, here's the stomach. If you go down here, you see the hypogastric region. Hypo means low or below. On the left, you have the left hypochondriac region. Hypo meaning below, and chondri being coming from chondros, I believe is the term in Greek, referring to cartilage or the ribs, the cartilage on the ribs. You have the left lumbar region, lumbar being lower back, and you have the left iliac region here. And the iliac region is this kind of crease in the thigh and the between the thigh and the abdomen. And on the patient's right side, right iliac region, right lumbar region, and right hypochondriac region. And again, I want you to be familiar with the organs that are in each one of these regions. So if I said, which abdominal pelvic region is the right kidney located, you should be able to tell me right kidney will be over here in the right lumbar region. Let's see, I think I have a better slide here. So this gives you kind of an idea of the different organs in the different body regions. And you'll see, many organs take up several regions. And that's why, if you were to describe pain in the right upper quadrant, it could be pain from the liver or the gallbladder. It could be pain from the large intestine, the splenic flexure, the hepatic flexure of the large intestine. Likewise, if you had pain in the left upper quadrant, it could be the splenic flexure of the large intestine, or it could be the left kidney. Could be part of the stomach or even the pancreas. So you need to be aware of which organs are in which areas. If you had pain in the umbilical region, that's going to be entirely different differential diagnosis than pain in the left lower quadrant. And this should help you. I would print this slide out and just make a chart of your own and quiz yourself and make sure you know where these organs in particular are in both the quadrant and the 9 region diagrams. This again is for your own review to use as you see fit. You could either write the organs that down in each box that you might find in each region. You could just label each one of which region it is, or you could even sketch a little, diagram of which organ is where. Just use it however you see fit, but I really recommend that you know these regions inside and out.